This is my journey. Inspired one story at a time, a library of leaders was created. It began as a journey to learn. As time went on, it began to grow. All it needed was a platform, and this podcast was created to listen, to inspire, to share. I am a storyteller, and this is my journey. Welcome to another episode of Profiles in Leadership. I am your host, Steve Anderson, and today our guest is Kristi Henderson. Kristi is a healthcare leader, digital health pioneer, and clinician who advanced from a practicing nurse practitioner to CEO and is recognized as an industry thought leader for technology-forward healthcare companies. She is a cultivator of high-performing teams with a keen understanding of drivers of growth, profitability, and equity value creation, who also fosters a civic-minded culture, resulting in a high level of collaboration and commitment. She is the CEO of Confluent Health, a national value-based musculoskeletal health company, where she is responsible for expanding their nationwide services through the growth of community-based physical therapy clinics, workplace services, and virtual digital solutions, using the highest skilled therapists and innovative clinical pathways that optimize the latest in personalization and technology. She was most recently the CEO of MedExpress and Optum Virtual Medical Group at United Health Group, with former leadership roles at Amazon, Ascension Health, and the University of Mississippi Medical Center. She is the immediate past chair of the American Telemedicine Association. She is a fellow in the American Academy of Nursing and remains active in healthcare education, providing guest presentations and serving as an adjunct faculty member. She is an honorary dean at the University of Washington School of Nursing and an adjunct faculty member in population health at Dell Medical School at the University of Texas, Austin. She has testified before multiple U.S. Senate committees and given numerous presentations across the country, including a TEDx talk to advance telehealth policy and share innovative new models of care. She received her Doctor of Nursing practice degree from the University of Alabama at Birmingham, where she was recognized as the 2019 Distinguished Alumnus from the School of Nursing. She maintains national certification as a family and active care nurse practitioner. So, Kristi, welcome to the program. It's great to have you on today.
Steve, so excited to be here. Thank you. I've been looking forward to this.
Now, that's quite a resume, and I will tell the listeners or the viewers that I had to cut out about half of it, so it's impressive. So you've done a lot in your career.
Well, maybe that says something about my age. I don't know.
Let's just go ahead and start by kind of fill us in about, give us a little context, where you grew up, how you got interested in healthcare, and kind of a little summary of where you are today.
Yeah. So, Steve, I have always loved healthcare, and it actually started with my first job. I was actually lifeguarding at a water park, and that seems like a dream job for every teenager, which it was, except that it was a water park, and there was like regular injuries, from head injuries to near drowning. So I was like thrown into really emergency medical care. And so it started my interest in just that profession of emergency medicine. And so I started volunteering at the academic medical center there, and this was in Mississippi. So at the University of Mississippi Medical Center, started volunteering in the emergency department, fell in love with it, and decided to go back, go to school and college for nursing. And so I started there in the trauma center as an emergency nurse, and that really started all of my love in healthcare. And when you work in emergency medicine, you actually see the worst of the worst, and you see why the healthcare system is so broken. You see, well, it's really the outcome because of it being broken, that people aren't getting access to care when and where they need it. And you just see the impact of all the other things that influence health coming to a head. And so I just, from that experience, set on a quest to really be a part of trying to solve healthcare delivery problem in our country, which led in a lot of different ways that we can get into. But that's really where my interest in healthcare began.
Yeah, that's fascinating. In the ER, you see it quickly and right away. That's for sure.
Absolutely.
So tell us a little bit. Yeah, and we can get more into that, but I'm also interested. So, how did you get identified as a potential candidate for the CEO of Confluent Health?
So this is interesting. An executive search firm reached out to me. They had known me from when I had gone to Amazon. And they reached out and said, "You need to listen to me, and I think you're going to really be interested." And I was like, "I'm not looking." and and so this was over many, many months and many introductions of meeting folks within the company, on the board, and just seeing the potential in what was within this company. It really excited me. And when the search firm reached out, they thought it would be a good fit just based on them understanding what motivated me, what I was interested in, and my background, and where they were wanting to go with the company. And so that's as simple as that. I guess it's a lesson to answer your emails or answer your phone calls. You never know what's on the other side.
Yeah, absolutely. So tell me a little bit about this Seattle connection because I'm obviously from Seattle, and so you worked at Amazon, and you also have a connection with the University of Washington. So tell me how that came about.
That's right. So when I was at Ascension Health, uh, I had actually done a presentation, and somebody from Amazon was in the audience. And from that, I got a phone call about, "Hey, we're interested in you coming to work for this top secret. We can't tell you anything more. Opportunity within Amazon." So, well, I was intrigued, and got the best of me. I was like, "Well, it's Amazon, and they've got to be getting into healthcare because they wouldn't call me for anything else." And that was what my presentation was on. So, I put two and two together, went out there, and really was excited to be a part of Amazon's entry into healthcare when they were just pre-launch Amazon Care. Joined the group there to help them build a clinical group, design what home care would look like, help working with engineers and other clinicians and other business leaders to help design what we thought was a new way of doing healthcare. And so I lived in Seattle during that time, and got to know the folks at the University of Washington, really thinking about how do we recruit and the best talent in here. And so we wanted to go upstream and work with universities as well and be a part of that. So that's how I got introduced to University of Washington, and then started working with the dean there, and had a big passion for really developing the next generation of leaders and thinking about the new way of delivering healthcare, and thought we need to infuse it early. And so that's the connection to Seattle and to the University of Washington.
And so now that's the program that was started. Atul Gawande was the head of that, correct? Is
So
it
Atul Gawande led Haven, which was a separate one with Berkshire Hathaway, Amazon, and that was different. This
okay?
was Amazon Care was launched in Seattle, and it was there. Now it's rolled in, or I would say rolled into One Medical. So it was the separate, it had 24-hour, you could see a doctor or a nurse practitioner within like a couple minutes. And then we could send somebody to your home or your workplace if you needed medications, injections, treatments, anything hands-on. So the clinic was in the home or virtual. I guess I should say in the workplace too. So we built out a team, launched that, and then they started selling that to employers. Then they bought One Medical, and the groups came together. So the Amazon Care as we know it is no longer.
Yeah, and that's my next question. I mean, so many of us when we heard about that were so excited and oh my gosh, this is the way of the future and look what's going to happen and this is great and it didn't happen. So what happened?
You know, even if I look back and reflect on it, I would say that one thing that Amazon's good at, and so are some of these other, innovator startup companies, it's okay to fail fast. I wouldn't say it's a failure. We learned a ton, and there was great successes, but then the learning was, hey, we really need to not only have technology, but we also, if we're going to make a difference in where the biggest spend is and the most complex care needs are, we need to have a physical infrastructure. And so, pivoting that and changing the direction is learning. And so Amazon Care folded, One Medical started. Now they have all kinds of great concierge technology, and they've got Amazon Clinic now. And so I think that Amazon in particular just learned from that and iterated and pivoted. So they're still in healthcare in a strong way, from pharmacy to online Amazon Clinic, and they're One Medical. And, there's others that have done similar things. I think one thing I would touch on is that, during the pandemic, everything switched to digital. And then now we're back open and operating in our in-person way. And while digital came down, it's still much higher than it was pre-pandemic. So it's still moving up and to the right. But now we have this opportunity to not do either or, but to blend the two together and meet the individual with what they want and what they need based on their clinical conditions. So it may be virtual, it may be digital, it may be in person. And so that's how I would say. I think it was an advancement in the healthcare delivery system. We learned and we evolved from there.
And did you have direct interaction with the tool, Gawande?
No, because he was with Haven. So
Okay, so
yeah.
yeah,
So
yeah,
Amazon Care at that time was under Bobick, and Kristen Helton was our leader for that program. And we were in their kind of incubator pre-launch. And then
yeah,
at that time, it was moving from Jeff Bezos to Andy Jassy
yeah.
leading the company.
Okay, so now you get recruited and you get this offer to become the CEO of Confluent Health, which you came from outside the profession. You came from, obviously you're in healthcare, but you come from the nursing background, and now you're joining basically a PT company. So that must have been a bit of a leap. And what made you? How did you make that decision? Why did you make that jump?
Well, first, I think that being in healthcare for as long as I have been, I have seen kind of all the aspects, and first started in a traditional academic medical center. So one of my roles at the University of Mississippi was the chief advanced practice officer. And so all non-physician billing providers kind of were my responsibility to advocate and work on everything from comp plans to quality standards. So that included all the billing providers like physical therapist, occupational therapist, pharmacist, nurse anesthetist, nurse practitioners. So I'd always seen how important those providers were to the healthcare delivery system. And even during my journey in all the different places that I've been, musculoskeletal is always one of the top areas and conditions that are being treated. And so if you really want to make a difference in the healthcare, looking at this area was incredibly important. And when I stepped back and looked at the opportunity and what the assets were within Confluent and where they had been building this company to and where they wanted to go, I thought they were incredibly well positioned, and that the timing was right in the industry, as you even see through APTA and other groups, APTQI, the economic value of PT. And I just think it's the time for PT to stand up and to really take hold of being the primary care of musculoskeletal health. And so that really motivates me. And I'm one of the best learnings that I've had coming into this space after meeting with our therapists across the country was just, number one, they're incredibly nice people, mission driven, but they are incredibly skilled diagnosticians. So I'm just really pleased to be in here, and they've been also welcoming. The first 90 plus days was listening tours and just talking to people. Where are the pain points? What do you need? How can we improve the delivery system? And what are your barriers? And so I learned a lot. And while physical therapy is different than nursing, is different than medicine, there's a lot of similarities around what are the headwinds, and then collectively, I think we have a lot of momentum. And so all of that excited me.
So for those of us that aren't inside Confluent, describe to us what is the structure of Confluent and how does it operate as a company?
Yes. Okay, so Confluent Health is a comprehensive musculoskeletal health company that operates under through diverse business units, 4 business units. We have our clinical services, which is our partnered clinics and our network clinics. That is kind of the core of what so many people know Confluent Health to be, and really where it started. And then we have our employer business, which is also where we are working with employers in delivering injury prevention services. So think safety, ergonomics, injury prevention, functional testing. Both of those we're a house of brands. So no one knows Confluent Health as a consumer facing brand. But in our clinics, we have all of the local brands remain. We believe healthcare is local. And those leaders that choose to partner with us, we have a partnership model. We maintain that. And then we bring in enablement services or shared services to really pour gasoline on helping them grow. So that's a house of brands. And in our employer business, it is Fit for Work and Work Steps are the names people would resonate with. We also have our innovation arm, and this is where we have some investments in different companies, some doing pain management and things that are kind of adjacencies, but very related to musculoskeletal. It's also where we built our hybrid platform to be able to deliver care virtually, digitally, or in person. And we actually launched that this year, Movi Health, and started selling that to employers in January, and really excited about not only the outcomes, but engagement that we're seeing from these employees, all focused on helping employers with where their greatest area of spend is, which is musculoskeletal health. So the last area is evidence in motion, and many know about that educational company that started out of really supporting the educational needs of our existing PTs, and it's evolved into a graduate health sciences education program where not only do we have partnerships with universities for DPT students, but we also are doing it in OT speech. We've now got physician assistant and other programs as well. So it's really become transferable over into other graduate health science programs. So if you step back, Confluent Health is the umbrella that houses our clinics, our employer workplace health solutions, our education, and our innovation arm.
And in that education piece is, I know the first PT program that Evidence in Motion was involved with, I believe, is South College, and now it's evolved into multiple. So is that part of Confluent Health too? You run and create physical therapy schools, correct?
That's correct. So
Yeah.
we partner with universities, and we take it from concept through accreditation and launch. So curriculum development, faculty, marketing, we kind of have this toolkit that with universities, we can launch those programs. And so, well, I think we're up to now maybe 14 universities.
Oh, wow. Wow.
Just in January, launched another 3 programs. So there's as we all know, a healthcare workforce shortage.
Yeah.
So it's really exciting. The work that Larry Benz and John Childs and others did early in the launch of Evidence in Motion, the focus that they had on building an accredited, accelerated 2-year hybrid program is really, it addresses so many needs. One, from just the students, not only from convenience, but also in lower student debt because it's a 2-year. And then it's great for the universities as well, as they want to add more programs and serve their community. So it's a great program.
Yeah, it really is. And I've known Larry for many, many decades. And
Yeah,
one thing about Larry is that, when he gets an idea, he gets it done. It's like
he does.
it's just
I mean,
crazy. Yeah.
this company is amazing. I mean, it is multitude of new companies that he started within this company, and they're all independently very successful, but together they're highly synergistic. And so his vision is quite amazing, and I'm honored to be able to lead the ship.
Well, in thinking about our conversation today, it made me think of, I was the CEO of a pretty big company in the Pacific Northwest. So I know what it feels like when you're perceived sometimes as an 800-pound gorilla. Like,
Mm.
you're so big and you're encompassing so much, and some people get uncomfortable with that.
Mm.
What intrigues me, because, I have my ears to the ground a little bit in this profession, and I never hear any negative things about Confluent Health. I never hear about people joining and then being unhappy. I never hear about people feeling like you're trying to squash their world and take them over and things like that. So what is it about this company that avoids that? Because many of the other bigger ones, don't have that same reputation.
I love hearing that, first of all, and I've had the honor to now be here a year, so I will not take credit for the long history of what amazing leaders in this profession have done to create this company, and my job is to continue to foster that. And as you get bigger, that gets harder. So I would say that there's a couple things that I would say. First and foremost, it's the people. You've had other people that work here on the show recently. You know, Bridget Finley was one of them. I mean, these are amazing leaders in the profession that are known and respected by their peers. And some of the really fun part to watch is them. Many of them went to school together. They were in private practice together. They have, you know, through all of this, thick and thin, through the pandemic, they have been in the bunker. And so when you get great minds like that together that have such respect for each other, and some of the oldest PT practices in the country, amazing things happen. And so the sharing of ideas, the collaboration, the spreading of best practices is contagious. And so the company is successful because of those leaders, and this company is led by those leaders. I'm here to remove barriers. I'm here to set a vision, a pace, and a direction. And I do that by having my ear to the ground and going around listening and figuring out, you know, how can we differentiate, and taking lessons learned from other areas of healthcare and bringing that into here. And so I would just say it's the people first and foremost. But there's a lot of very intentional things that we do to foster collaboration, and a lot of discussion around keeping healthcare and the relationships local, removing burden, and that may be doing some things regional and then some things at a national level. But that's something we always have to calibrate around, never losing the trusted relationship between the therapist and their patient, and the therapist and the provider community that they're helping to manage the musculoskeletal needs for their patients.
Well, again, my left field observation from the outside is just that I think you used the word several times, and I would say that's what it feels like is you're open to that collaboration, you're open to other ideas where my experience has been a lot of bigger companies, purchase smaller groups, and then they say, okay, now this is how it's done. And they
Mm.
already have their set way to do it, and they try to put everybody in the same box, and they try and change the practices, and I think that's kind of where people get frustrated. But if you really are open, and it sounds like you are, to collaboration and to learning from others and doing things in a different way from people that have a lot of experience, then that fosters camaraderie and being a part of the team as opposed to just being a piece of something that you don't have any say in.
Well, Steve, one thing you made me think of is that, first of all, every single practice is unique. And when a leader and CEO of a company decides to partner with us, every one of them have a kind of a different reasoning around why they want to do it. And so at that very point, understanding what that is and being transparent around what that experience will feel like, and then how we can partner together to make sure um, that transition is smooth, that the therapists are taken care of, that there is look, it's not easy. I mean, everybody that has been through an integration knows. I think the intentionality and the open communication, the transparency is paramount. But the other is just from the very beginning, really understanding what that CEO is looking for in the partnership, and then laying out a plan around that is really important.
And in the PT platform, where are you? Are you the biggest company now? Are you close to the biggest company? Where do you
No,
sit?
we're
And
not, but we're in the, I guess, top three or so. So
okay,
we're definitely one of the big ones, but
okay.
there are some others that are bigger than us. And you know, I think one thing I'll say to that too is when we're not really looking to be the largest, we're looking to bring like-minded people together to do really important work in musculoskeletal health. If that means we're the largest, great. If it means we're the third, that's fine too. But it really is very important that as partners come in, that there's a cultural alignment. And sometimes that means we're walking away from an opportunity, and other times it means we've got a great new partner. We've had some great new additions coming in just this year, and excited for more. But I would say we're not really looking for just a lot of dots, but we are looking for improved access and a good cultural fit with other PT practices that like our model.
And I would just say, from my experience, I came from a collaborative group as well, and when you do have those good fits and people are part of it and they have the same vision and the same mission and everyone's on board, then the access to resources and things like that are just very compelling because to be by yourself in a small practice these days and with all the struggles with third party payers and regulations and this that and everything, it's I think it's a lot scarier to be out there by yourself than to be part of a group that collectively can maybe make some big changes.
Absolutely. Every one of the partners I've met with that have joined since I've been here have all said that exact same thing. And there's just such comfort in having, it's almost the best, the model that we have in my mind is the best of both worlds. Keeping what's great about running a private practice, yet having the benefits of a skilled organization that has resources and can take the things off your plate that you don't want to do. It's not that you can't do it, you don't want to do it anymore. And then with our scale, we're able to have all kinds of things around negotiating power and discounted rates and just make it simpler for them to do what they got into the profession to do in the first place. And so it's been remarkable to see how this all works and within this
Yeah.
company and to get that kind of feedback. Because what you said is what I'm hearing. It's not always perfect. We don't always get it right. But I'll tell you what, we're definitely very transparent and willing to work with any of our partners to help them to continue to grow.
Yeah, absolutely. So how involved is Larry Benz these days? He used
Yeah.
to be in your seat and now he's moved on, I believe, as chairman of the board. So how involved is he in the day to day?
Yeah, so I would say that, he and the board had been talking about bringing somebody in well before there was any reach out to me. And so this has been a plan for a while. When I got here, I had the benefit of having overlapping time periods where he could mentor and be there. And so then over several months, we just started kind of backing off and I would lean in more. And so that was incredibly beneficial. He connected to me to people across the industry, which has been remarkable. So he's still active on the board, still a large investor in the company. So see him regularly. He's always available for us as we need him, and he continues, as you can see, to advocate for the profession through all kinds of different ways. And so he loves healthcare and so innovative and creative. So he's, I'm sure, working on many other things with our sponsor partners group as well. But anyway, so he's definitely still involved.
Yeah, yeah. And you relocated to Louisville, is that right? To
So
take
I'm
this
in
position?
Louisville quite a bit and on the road more than that. So
Okay.
we've got practices in 38 states. And so if you reach out to any of them, they will tell you the story of my road trips. So I am on a journey to get out and see them all. And so with as many as we have, it will take quite some time as more are coming on. So anyway, it's been
Yeah.
a lot of fun. So I'm on the road more than I am any one place. But yes, I am. I do have a place in Louisville now.
Yeah, that's really interesting. And I mean that's an exciting life, but it's a hard life. I mean, you're gone a lot and I can just imagine again relating to my situation back in the day, just getting to all our clinics was what was really tough. Yet that was my style. Sounds like yours too, relationship building and seeing them on their own turf and talking to them individually. But to do that, that's a Herculean task. And you're gone from your family a lot, sounds like.
I am, and they are. When I decided to take this role, the family was definitely involved and knew what I was getting into. I think I've always been like this. Whatever job I have, I definitely value the relationships and feel like being on the ground, seeing people, not just the CEO of those brands, but getting in the clinics, talking to a patient, you know, testing out the waters. Matter of fact, before I even started this job, I went into one of the clinics in Texas as a patient. I actually tried their online system, called their call center, scheduled an appointment to see how it worked, and then went in as a patient. So I go all the way to that level to be able to be invested and to be able to, help lead the company.
Yeah. And so what if you can share with us what's the long-term game for Confluent Health? I mean, do you just keep doing what you're doing and just it is what it is, or do you I know you can't share company secrets, but is there some big event that you look forward to, or what's the long term strategy at Confluent?
So, you know, you worded it as, do we just keep doing what we do now? I think that never works in any area, that you can't keep doing exactly the same. All of a sudden the world passes you by. There's plenty of books written on that, from Netflix to Blockbuster, whatever it may be. But I'll tell you that to me, it's around continuing to look at ways to improve the clinical experience from both the clinical team and the patient. So the experience of both of those, and that's an interaction line between the patient and the clinician. And there's all kinds of things that we can do to improve those on both sides. So you're going to see us working really hard on just what the experience is in musculoskeletal health in a PT clinic, in a digital or a virtual environment. And then there's this other side that I'm really excited about continuing to work in, which is innovation and payment models as well. And so whether you call it value-based care, well, whether you call it concierge medicine, whatever it may be, I think the two are really important as the industry progresses, for us to continue to innovate in both spaces. And so you're going to see us do that. Our model, the partnership model that we have, we're going to continue to do that. Great practices that are interested in joining Confluent, we're going to keep partnering. So you will see that, and that will feel very similar and continuing on. We do know how to do that. We know how to do that at scale, and we're looking for great practices that can help us continue to deliver great care. So you'll see that. You'll also see us continuing to innovate in the workplace area as well as in the education. Across all of our business units, there's kind of this, what's the next horizon? And that strategy and visioning is being co-developed with all of our leaders across the company. And so things will look very familiar, yet also some places you'll see some surprises every so often.
So how does it work from a financial perspective? I realize that if I sell my practice to Confluent Health, there's a transaction there, and I make some money doing that. And then I believe I get some kind of Confluent stock or some kind of equity money, but you're not a public company, so it's not like when the value goes up, I make money on that. Do I just hold that until some other event happens, or how do I get my second dip, as you might say, when I join Confluent?
Well, every deal is a little different, but I mean, for kind of just a base, the partners come in, some of them, they'll retain a 15 to 30% or so. It varies depending on the individual and what they're looking to do. And so they'll maintain that equity. There have been, and there are all opportunities where they can redeem that, whether that is, there's a couple different ways, but there are places for that to happen. Partners Group has been invested now for 5 years, and continues to be interested in continuing to invest in us and the go forward. So what we're seeing is people coming in, and this allows them at that time, well, we will buy the majority of it, they'll maintain a minority of it. And then different times, whether that's a tender offer or there is another successor that they want to start allowing to buy units as well, there's a way for that to be another vehicle for some redemption of their units as well. So there's a couple different ways, but that's in general the
Okay.
model.
And it intrigues me too when I think of you buy these practices that were started most likely by a single PT with one practice, and then they grow, and these PT business owners are used to making all the decisions by themselves and whatever, and now they're joining a group where, quite frankly, they're not going to have that decision making power. So I imagine that's a transition, and I'm intrigued that there's got to be some blips along the way there with somebody saying, "Hey, I don't believe in that. I don't want to do it that way." But yet I'm part of this group, and now I have to go with the group decision.
Well, I might go back to even what you said earlier, which is, when you're talking and on the street, hearing from people, you hear positive things about when they join. And that goes into what you just asked, which is, how does it feel transitioning from a private practice owner to now being in a group? And we're very intentional about managing kind of expectations and what that will look like when you come in. But the whole point of our company, our partnership model, is to allow great PTs and great owners to be able to do exactly what they do and to bring, take off burden and bring capital and resources to allow them to grow faster and have more success. So absolutely, it's a change for people. All of a sudden, there are different people they've got to meet, different meetings they need to go to. They used to just be able to go sign something and make a decision, and so we try to make sure that there is. We try to minimize red tape. We are a large organization, but my goal is to be able to just really fuel them and allow them to be successful. And we bring in resources when there's challenges. And so I think it all comes down to trust and communication, and we don't always get it all right, but we know exactly how to pick up the phone and get to a common ground that makes sense. So it is a transition process, but part of that integration timeline is around a phased approach to how we're going to really integrate a new company into us. And we do that at a pace that's really guided by that CEO and us to make sure it is best for the therapist and for the community.
And one other question that just came to mind is, do you have people inside the organization that are going out and seeking these potential partners that join Confluent Health, or are there brokers that are bringing clients to you?
So it's a little bit of all the above. I would just say that so much of our pipeline to date, largely because of Larry and others that are so well known across the industry, but word of mouth carries. And so when somebody joins us, they tell other people about their experience, and then those people, when they're ready, come to us. So I'd say word of mouth is probably number one. Number two is that people have touched our organization in different ways. They may have gone through Evidence in Motion and heard about us. They may have been a work step site, various different ways they've kind of touched or bumped into Confluent Health. And so they then will reach out when they're ready. Our PTPN network is another place where independent groups who then decide later to join an organization like Confluent, they've learned about us that way. So I'd say that the pipeline is more proprietary around relationships and word of mouth, but definitely we have brokers and others bringing deals as well to us for us to evaluate, which we're always glad to be able to do that and enjoy working with them.
So let's switch gears a little bit. So I know that you have a background in telehealth. And again, I just thought it was really interesting. Before the pandemic, I heard in many, many, many PT meetings about, we should do telehealth, we should do this, and no one could figure out how to do it, or no one took the time to jump in and do it, it seemed like. And then the pandemic hit, and then everyone figured it out like in 3 weeks and got it going, and a lot of people are doing that. And then my impression is that now that the pandemic's over, they've gone back to not utilizing telehealth like they were. And since you're kind of an expert in telehealth, give me your opinion on why that is, and what should the future look like in telehealth relating to physical therapy.
So I would say that if you look at the adoption of telehealth from before the pandemic until current, you absolutely see this huge spike when all of our clinics were closed or at partial operations. And then it came right back down to something much, much lower. And you can either interpret, if you look at the graph from the pandemic forward, you'd say telehealth is dead. If you back up and look at telehealth's journey and you follow the line graph, you're going to see an up and to the right. So take out the pandemic because it was an anomaly. That's kind of like all of us, even our finances. Take out that period during the pandemic where it doesn't make sense, but you will see it's continuing to grow and be adopted. The other thing I'd say that influences this is that it's one thing when our clinics were closed and somebody needed an appointment and you said, we'll see you over telehealth. Now they call into your clinic, and what happens? They schedule an appointment for in-person. Most front desk or online scheduling tools don't have the ability for somebody to pick and choose such as this. So until we really change the model where physical and virtual go together, I think you're going to still see some of where we are right now, which is a slow climb. Telehealth's not dead, and it's absolutely going to be an important part of therapy care. So think about what percentage of episodes of care the treatment plan is actually completed. the inconvenience of going in person. And so if we can free up capacity in our clinics for ones that do need hands-on or use of a piece of equipment or a diagnostic that is only in clinic, if we can free up some of that capacity for those people and see some that can be taken care of virtually, we're just going to be able to serve more people. So I'm excited about continuing to use it, and you'll see that within Confluent.
And I don't know if this would be different, but I'll ask this question anyway. So, what are you most excited about? What innovative thing are you most excited about in the world of physical therapy going forward?
It actually touches on what we were just talking about.
Okay.
I think that ability to individualize care and optimize what we do in the clinic versus virtual or digital, that hybrid model, is incredibly exciting to me for a couple of reasons. One, it's just more convenient and it's better use of our resources, and it helps us get the outcomes that we want. It doesn't mean you are going to ever deliver care in a setting that wouldn't achieve the quality that you want. So you wouldn't do it virtual if you need to see them in person, is what I mean, or vice versa, right? So I think that the other piece of that I'm really excited about is because when you have that type of model, you can work upstream, up the funnel sooner, and help people at the decision point. So at the very beginning, if they're trying to think about where do I need to go to get care, if we can make it super easy to have that digital front door to be able to chat with a therapist or see a therapist and get advice and get intervention, we're going to be able to be at earlier upstream, PT early in the model of care, where we can really start impacting the total cost of care and the site of care. The traditional pathway, as we all know, is still more of a PT last, from primary care referral to ortho and then PT after a surgery. And I'm over exaggerating it for simplicity. It's not always like that, but we definitely don't have everyone getting therapy that needs therapy. And this model would allow that to happen.
For sure. So, what does the executive team of Confluent Health look like, and who are the players on that team? You don't have to go into extreme detail, but I'm just curious, who runs the company from the executive level?
So on our clinical services side, that arm where we have all of our outpatient clinics, we have regional leaders. So we have the CEOs of the company, and we have regional leaders as well, many of which who have run some of our biggest and largest, most successful brands. So the David Browders and the Mike Pappas and John Waite, and I could name more of them, Andrea Bauman, Pat Wimpy. These are the folks that are our regional leaders. So we have regional leaders, and then we have that team. Andrea Bauman, who came out of Pro Rehab, sits as the senior vice president of operations. So they all sit together, but we have functional leaders that are supporting everything that you need to run a practice. So we have our chief people officer and chief legal officer and finance and all the things that you would expect. So it's a PTs lead their practice. We have a regional leadership team, and then we have our functional leaders across the traditional areas that you would think about.
And if I were to ask that group of individuals you just described, how would they define your leadership style?
What I would hope you'd hear and what I aim to be, and you should ask them, is first and foremost transparency. Transparency and empowerment is my goal. So if we can talk about what the needs are, explore options. I'm very curious, so I'll ask lots of questions that they probably would say that. And that's why I'm out in the field going to visit. I want to see, I want to hear, and I want to really understand. I feel like I'm a better leader if I can really see and understand the experience of our team and our therapists and our patients. And so when I'm in clinics, I ask patients how things are going. I talk to the therapists, the students, and it just helps me really, have a day in the life to some extent. And I will always reflect back to my own time. I practiced as a nurse practitioner for 24 years. And so I know what it feels like to have that responsibility of taking care of patients and wanting to do a great job. And so that's always comes to my heart when I am leading, is that clinician first, relationships first, quality first, and the rest of it is secondary. So I think you'd hear transparency, curiosity, and empowerment is some of the characteristics.
And this is a real general question, but I'll ask it anyway. How are PTs and nurses different since you've had a lot of experience working with both groups?
Oh, wow. Well, there's a lot of similarities first in that they went into the profession to help others. I would say that, nurses in general are not providers unless they're a nurse practitioner. So I'm gonna put the nurse practitioner and kind of the therapist as well, maybe as the comparison there. Both billing providers, I think there's a lot of very similar journey that they're both going on and at different stages. So I was actually talking about this at the Graham sessions this past year, and we were talking about techs and PTAs, and we were talking about scope of practice and all of that. And these are same things that nursing had been through and I'd been a part of, and even gone and advocated at the federal level as well as the state level around policy change to get reimbursement changes, scope of practice changes. And so there's a lot of similarities into the journeys there that I would call out. I don't know about so much differences. I mean, they clearly have different roles, but there's far more similarities than differences.
Yeah, that's really interesting. What's the most surprising thing that when you started this job, you came in and you was your aha moment or surprised you about working with this profession in this company?
I would say that the most surprising, it's not that I thought therapists were mean, but they are so nice. So I actually will just go back to they're great people. I think the part that surprised me the most is maybe the as an industry, the readiness of payers and the broader healthcare ecosystem to really partner with therapists as a part of the care team and a part of the solution. So I'll give you an example of even when I talked to some payers, just to say, hey, look, I'm consider this was actually before I even took the job. I talked to some payers just to say, what do you think about PT? And it was just fascinating getting their responses and realizing we had quite a bit of education to do around the value, the economic value, and how important PT first is. And so I think that was probably the biggest surprise of how much work we still had ahead of us.
And maybe you just answered it, but I'll ask it anyway. What do you think is the biggest challenge of the physical therapy profession going forward?
I'll actually say two. I still think workforce is a huge challenge, and we have a shortage. We have a lot of therapists that are looking for a different experience and want some of this burden removed from so that they could find joy in their profession and continue to work a long career in therapy. So I think we have work to do on retention and recruitment all the way back into choosing PT as a career. And there's all kinds of information and podcast on just the challenges in student debt and the things and reasons why people don't choose it. So I think that's one of our big challenges. The other one is decreasing reimbursement and really positioning therapy not around a fee for service model, but really recognizing the value that it brings and the downstream impact it has, so that there is different payment models and incentives around the broader impact that we're having. So that's going to be a huge area of my focus and time, which is educating, advocating, giving case studies, and really demonstrating the cost reduction when you have PT involved in musculoskeletal health.
Well, Kristi, in anticipation of our discussion today, what haven't I asked you that you want to be sure and get in the program today?
You've actually done a really good job asking a ton of questions in so many different areas. I think that there's not anything you didn't cover. I think that I have practiced a long time as a nurse practitioner. And so I have a real passion for providers, and coming from the NP space, really being able to advocate for this profession similarly that I did in nursing is really important. I just have been so impressed with the professionals in this industry and how open they've been to partnering, whether they were competitors or within our own company. And so I'm just really excited about continuing to work within the industry and collectively all of us rising the boats and really putting PT where it needs to be in a PT first model.
And at this point in the interview, I always ask my guests the same common question. So that question is, in relation to leadership, what is a pearl of wisdom that you could leave us with today?
I think as a leader, listening and being curious is at the very forefront of decision making and being able to earn trust. And so I always come with a curiosity first, listening and leading. It's my responsibility to set the vision, the pace, and the direction, but I can't do that without being informed by those that are in there providing care, leading the different divisions of the company. And so curiosity and listening has to be first.
I love your response. I think curiosity is an amazing word. And I do think that the best leaders are those that are so curious. You know, you can go back to, Abraham Lincoln all the way to current leaders and whatever. And I think that word curiosity often comes up with the best, that they're just genuinely curious about, people and how things can improve and what could we do differently. And I think you said it very well. So thanks for sharing that.
Absolutely. Thank you so much, Steve, for having me. It's been a delight.
Well, it's been a real pleasure. We did meet finally at the Graham Sessions last January, and heard a lot about you. And again, I would just say that yeah, that your people sing your praises, so that's always great to hear. So it's been a great discussion, and it sounds like you've had an amazing career with a lot of different things to do. An envy of many, I'm sure. So. I commend you for just doing such a great job with this company and being a part of our profession now. So thanks for all you do, and it's been a great discussion. Thanks for sharing.
Thank you so much, Steve.
Okay, take care now. Bye
All
bye.
right. Bye.
Thank you for listening to another episode of Profiles in Leadership. To listen to all my interviews, subscribe to Profiles in Leadership with Steve Anderson on Apple Podcasts, iTunes, and many other popular podcast platforms. Some of these interviews are on video, and you can search YouTube for Profiles in Leadership with Steve Anderson. You can also access the entire library of interviews on my website, orange.coaching.com, and that is orangetheword.coaching.com, and go to the Media Center and click on Podcasts or Video Gallery. You can also enter the website from pilpodcast.com.